When you first hear the words, you've got cancer, it's quite scary. And the next scary sentence is you're going to need chemo. All sorts of things go through your mind. Is this the nuclear option? What's happening? And we're about to go and have a coffee and a chat with somebody that's had these thoughts go through their mind because he's currently halfway through the chemo procedure himself. So come and join me. Let's go and have a coffee and a chat. And what this very brave man has to say is going to help you. So do the normal thing of subscribing and to read some comments. So if you have some thoughts about this or questions you wish I would have asked, this is actually going to be one of two. Steve is halfway through his chemotherapy journey, and when he's completed it, we're going to have a follow-up meeting. So press the bell, you'll have notifications, and then I think Steve's a very brave man, and my purpose for this video is just to help some other people that have just heard they had chemotherapy and they're going to need to go through this, and so hopefully it helps. Let's go meet Steve. So hi Steve, thanks for doing this with me today.
Pleasure, Mike.
We'll just have a chat. So is that all right, Steve?
Yeah, of course it is, Mike.
Excellent. So
question one, can you tell me what it was like when you first found out you needed chemotherapy?
Yeah, it's well, first and foremost, it was a bit of a shock. It was a double-edged sword, really, because I was anticipating I would go straight to an operation.
yeah,
So being given the opportunity to have chemotherapy deferred a likely operation, because that's the trajectory I'm on at the end of chemo. But having the chemo first has given me time to think about the whole diagnosis and what it means for me in the future. So first and foremost, I was shocked. Then I was relieved because it was chemo and not a straight to an operation. And now reality is sort of catching up with me, and I'm trying to come to terms with the diagnosis that I've got and the likelihood of an operation. That is the trajectory I'm on.
Thank you for sharing. I appreciate that. And am I right in assuming you're halfway through the chemo?
Yeah, so my last chemo is the 22nd of August, and that will be 8 sessions. And this coming Friday, I'm about to have session 4, so just about halfway now. They will restage the disease once I've had the full number of chemo sessions, and that will determine the next move thereafter. And it can only be determined by repeat CT scans and MRI scans once I've completed this round of chemotherapy.
The second question I have here is, what were your biggest fears or concerns before starting treatment?
Yeah, I think I'd never heard anything good about chemotherapy, and the truth of the matter is, I think it's there, it's useful and helpful, and hopefully the chemotherapy that you have either shrinks the tumour or, in the best possible outcome, removes it. But it was a total unknown to me. I'd heard the word, and I'd only ever really heard people say bad things about chemotherapy and the effects that it has on you. So daunting, I think, is the best description. Daunting because a lot of the folklore suggests there's nothing good to be heard about it.
How did you prepare yourself mentally, physically, or practical ways before your first treatment?
First things I did, which probably a lot of people would do, is Google and try and make myself knowledgeable on what exactly the chemotherapy was. My particular brand of chemotherapy is called neoadjunctive chemotherapy, and its primary purpose is to shrink the tumour, to make any surgery that you have later down the line easier to perform, and hopefully be less invasive as a result. But I found Googling was fine. It gave me the information that I was looking for, but I also saw a lot of things on Google that kept me awake at night, which in reality haven't really applied now that I'm going through the chemotherapy in practice. So some of what I saw scared me, some of what I saw educated me, and on balance, I think it's a good thing to understand fully exactly what it is you're getting into. And I think it's only you that can find that out. People can tell you, give you subjective opinion, but actually making yourself uh, fluent's probably the wrong word, educating yourself to a degree where you can understand what they're putting in your body is a good move.
It makes sense, Steve. It makes a lot of sense, because I would probably do the same thing if I got told I needed chemo. So what's a typical day like for you doing the chemo treatments? Do you have breakfast? How do you start the day, and what happens?
Typical day, the first thing to say really is the first day that you have chemotherapy is completely different to the second time you have it, because the first time, in my particular case, I have a PICC line fitted, which allows the drug infusion, to be automatically pumped into the body, whilst you're in the hospital for one day, and secondly, that continues for me in my case, for over a Saturday and Sunday. So my chemo days are Friday, Saturday, and Sunday. One in the hospital, two at home. They send you home with a pump, which is a brilliant little device that allows you to continue the treatment at home rather than being inpatient in a hospital. But the first day is an awful lot of paperwork. That's the first thing. The second thing is, in my case, I had a PICC line fitted, which allows the drug to be administered, and that stays with me throughout chemotherapy. So a PICC line is a central line which runs from here in my arm up through my armpit, inside of a vein down towards my heart.
Okay.
And that is the line that they use in the hospital,
Yeah.
and I use when I'm at home for the drug to be administered.
So you have that in all the time.
It goes in on day one and comes out on the last day.
Going back to an average day, Steve, so you're in hospital, are you sitting in a chair? Is it comfortable? What sort of thing goes on, and how's that compared with being at home?
Yeah, so it's a very comfortable environment. Normally, I'm sat with 3 other people, and it's quite a luxurious chair that will recline, because you're going to be in the chair for, let's say, 8 hours. The environment itself is very informal. As I say, you're with 3 other people. You're free to take a partner or somebody to accompany you. It is the difficulty I find with the environment is obviously everybody's there for the same reason, and some of what you see is upsetting.
Yeah.
And it's difficult because cancer doesn't discriminate with age, so it can be young people, can be older people, and people at various stages of dealing with the disease.
Okay.
So that it can be, I say, shocking. There is a shock element to it, but it can be upsetting as well. So,
Okay.
yeah.
So having the option of being able to do this at home, do you find that easier?
Yeah, I think it's quite liberating. to be able to continue the treatment at home rather than being inpatient,
Right.
which is always what used to happen. They give you a small pump that goes in like a bun bag. It works off body heat. The pump doesn't need gravity
Okay.
to work it. So, and I just go back on a Sunday via an appointment, and they remove the pump from me until the next cycle.
Okay.
So it's really painless. It's easy to manage, and it's effective. So yeah, it's good. It's good that you can have it done at home.
Oh, all that's good stuff. And I guess you can choose your biscuits as well if you're at all.
You can, yeah.
Let's talk about side effects, Steve. Did you experience any, and how did you deal with them?
Yeah, well, I was acutely aware of side effects, and the hospital that I'm attending made me very aware, because obviously I was going to continue the treatment at home. And I suppose the most noticeable side effect is one of the drugs that I have as part of the infusion is a drug called oxaliplatin, and the particular side effect with that is if you go to a fridge or take a glass of cold water or try and have anything with ice in it, you get a very big shock because the drug reacts with the cold, even to the point that during the hot weather that we had, you couldn't have the air conditioning on in the car because it caused a reaction, which is in the hands and feet, a really big tingling effect, and in the throat, a gagging effect. If you try and drink a cold drink, it's very easily solved by drinking a warm drink. First and foremost, being me, I thought I'll obey the rules the first time round.
Okay.
And if I needed milk out of the fridge, I asked my good lady, could you get me the milk out of the fridge, Karen? Which lasted about 3 days before we probably both got fed up with it, and I thought I'd try it myself. And it was like having an electric shock when I went to the fridge.
Okay.
So I haven't been there since.
It wasn't just an excuse not to have to get your own milk then.
It's not. So that's one big side effect. The only other side effect really is I have had one bout of diarrhea, which lasted 4 days, which was very unpleasant, and that was during the hot weather as well. But that hasn't repeated itself on the following 2 cycles. So
Okay.
whether that was a one-off or just because of the heat that we were experiencing at that time as well, I'm not sure. I suppose my top tip would be prepare yourself by hydrating fully at all times whilst you're in a chemo cycle, because I think if it helps prevent or it helps lessen the effect if you do get a sickness or diarrhea attack, then it's better to prepare for it rather than treat it once it happens.
Was there anything that surprised you, either in a good or bad way, about chemo?
I think in a good way, actually with the disease itself, I to this day still remain asymptomatic. And with the treatment itself, a lot of the horror stories that I'd heard about chemotherapy, in my case, have not manifested themselves, with the exception of the 2 that I quoted, which have been perfectly manageable for me. Unfortunately, it's not affected me particularly.
We all need support, Steve, especially at times like this. So if I can ask you, have you got a strong support system, and your opinion, what have helped you the most? What support has been the best?
Yeah, I think what's helped me the most is Well, first and foremost, NHS Wales 28-day pathway worked for me, which basically, once you're diagnosed, it commits to consulting with you, providing a treatment plan and starting the treatment, and providing a support network. And I once I heard it, and immediately the cynical person in me said that's not possible. But I have to say they hit every target, every step of the way, or they have done so far. And I've been genuinely impressed with the support that I've had. The support of friends, family, is unconditional, but I've made a rule to be brutally honest about a disease so that people understand what I'm into, and I don't hold anything back in terms of what I tell people. And I try and update my group of friends, family, pretty much after each chemo session. I do it by WhatsApp so that I give everybody a consistent message. So there's 25 people that I communicate with, and they all get the same message, and it's a brutally honest message. And well, the thing it does for me, it stops me making 25 phone calls.
Brilliant.
And it stops the interpretation of one person versus another by doing it word of mouth. So if I'm allowed a top tip, my top tip would be communicate with people in the same way each time. Be very honest with them, and try not to do it by telephone, because people will interpret what you say in 25 different ways if you're talking to 25 people.
That's a brilliant tip about having a WhatsApp group. I really like that, especially to help the friends who care about us. Let's look on the bright side, if possible. How did you stay hopeful or motivated throughout your treatment?
Yeah, so that is difficult. Staying motivated, because you're dealing with the unknown, and all the time you're dealing with the unknown, really, fear dictates how you feel, because it's difficult to be optimistic about the outcome when you've been told the trajectory is an operation and a probable colostomy for the rest of my life. But having said that, you do become combat hardened. I think the reality of what you're facing and your own mortality, because at the end of the day you are facing your own mortality, is a very sobering experience, but one that forces realism in the final analysis, and dealing with the situation as it is becomes second nature. And that is a self-preservation second nature, because I think self-preservation is the motivation to continue.
Excellent. So does that mean that your life viewpoint have changed?
Yeah, it has changed, because faced with your own mortality, I think you could guess 100 times how you'd react to a situation, but actually how you react is dictated by the circumstances that you find yourself in. And I without being too cheesy about it, I want my children and grandchildren to understand what I'm going through, and hopefully take some comfort and take a positive message from the way they see me dealing with it, because who knows who's going to have to deal with it in the future.
Looking back, is there anything you wish you had known before starting chemo?
I think probably I would have wanted to understand the treatment plan at the outset rather better than I understand it now. I've had to fight quite hard to understand the treatment plan, and I think you have to take personal responsibility to ask all the questions that you need to ask to get the information to make sure you're fully armed with what exactly the treatment plan is, because the medical people understand what it is, but they're not necessarily the best at conveying it, and you're dealing with different faculties all the time. So a lot of the thinking isn't necessarily joined up. All the answers are there, all the information is there, but there's a kind of a personal responsibility on you as the patient to dig for it. And I honestly feel that can take a lot of pain and strain away if you're prepared to dig for it.
I'd agree with you on this, Steve. I've found that when you're in the system, everybody's got their plan, they know what they're doing, and we could just feel like we're floating around from one thing to another. And unless we start asking questions or get involved, or as you put it, take ownership.
Yeah, exactly.
Okay.
Well, here we are, Steve. Question number 10, the last question. So, what advice would you give to someone else, especially another person maybe our age, who's just been told they need chemotherapy? What's your top tips? What do you think?
I think the first thing I would do is make sure all the people that are close to you understand this is what's going to happen. Be absolutely honest with them. Promise to keep them informed, because they're worrying exactly the same as you're worrying, that they've got no control over what they hear. The only person that can give control is yourself. So that's the first thing. Probably the second thing is a personal responsibility message, that the treatment is there to be served up by the NHS, but make sure you educate yourself about what's going to happen. And if you've got any questions, dig until you get the answers, because otherwise those questions will keep you awake at night if they go unanswered.
Brilliant. The top tip I got there, Steve, was if you have questions, just keep asking them.
Yeah, you have to be an irresistible force.
Okay.
And you will come up against the immovable object, but you can prevail. I'm not, it's a right, it's your body, it's my body. I've got a right to fully understand and ask these questions.
Brilliant.
And they have a duty of care really to provide the answers. There's a lot of tests that have to be carried out. You have to do a fortnightly blood test, and the blood test has to show that you're coping with the chemotherapy before the next session can go ahead. It involves the support of district nurses to change the dressing on your PICC line. In my case, I'm having to prepare for an operation, which means going to 2 fitness classes a week. It's a full-time commitment being in treatment, not just the treatment itself, but everything that goes with it. So I kind of treat it like a full-time job and put full-time effort into it, because that way I can stay on top of it, and that way I know that I'm doing my part to try and be positive and do whatever I can to get the best outcome, whatever that turns out to be.
Brilliant.
Thanks, Steve. That's really helpful. Thank you for your honesty, your openness, and I really appreciate it. And I'll see you
Pleasure.
soon.
Cheers.